Hi, everyone. My name is Selena Belisle, and I am the founder and one of the instructors at CE Institute, where we teach hot stone massage. We primarily teach CE hours to licensed massage therapists to renew their license, but this class is for anybody who is interested in learning the most up-to-date safety protocols as this modality continues to evolve and change. While we're not reviewing a list that would be all of the do's or don'ts, that's something that you would get from a qualified CE class. In today's recording, we're just going to review some of the more recent changes that have been made about what is accepted in the massage industry still, and more importantly, what's no longer accepted or retired. To review this, we're going to talk about the article that was just published in Massage Magazine and is on the cover of the May 2021 issue, as you can see right here on the right-hand side of this website page. If you want to review this article in more detail, you can review it at massagemag.com and then just search inside the website for hot stone safety, and you'll be able to find this in their massagemag.com website. So in this article, let's review some of the hot stone safety practices that should be provided in every single hot stone massage that you execute, and perhaps some practices that should no longer be practiced. The reason why we are providing this hot stone safety update is because there have been some clients who were injured through hot stone massage practice and application. They were not our students. I do not know where these people were trained, and some of them might not have been trained at all. So it's really important, if you are going to practice hot stone massage, that you seek a board-approved class and appropriate training in hot stone massage prior to your hands-on application of this modality. Now, one of the most important points that I can provide you today is the American Burn Association has said that 130-degree Fahrenheit water can burn human tissue within 1 minute. And here at CE Institute, we teach an operating bath to be maintained anywhere between maybe about 120, 125 to 135 degrees Fahrenheit. So that means with any of our stones, within 1 minute of application to the skin, the client could potentially burn. We keep the stones in motion and use the placement stones in a different way to ensure that they do not burn, and we're going to review those today in this little review of this article. The first thing that I'm going to discuss is your stone massage heater. This is also known as the stone bath unit. Today, we have therapists out there that are using any type of heating element to heat stones, and that includes kitchen griddles and hot towel cabbies, which really aren't appropriate. The kitchen griddles only heat one side of the stone, so one side will be cool and the other side will be burning hot and probably too hot, and there's no way to measure the temperature of the stone and get an accurate reading on a kitchen griddle. So it's nice to forego the water, but it's a very unsafe practice and could potentially burn yourself as a practitioner or your client. Hot towel cabbies usually start at an operating range of 150 degrees Fahrenheit, which is way too hot to practice hot stone massage. What we recommend at CE Institute is to use a stone bath unit that can fully immerse all the stones in water, because if the stones are all immersed in water, they're more likely to be the temperature on your temperature measurement gauges. If you have the stones exposed to air and they're not immersed in the water bath, then it's a kind of guessing game about what the true temperature of the stone is, and different surface areas of the stone could be different temperatures as well. So while one surface area of the stone could be comfortable in your hand, the other area of the stone that might have been immersed in a bath that's too hot and you're applying to the client could be beyond your operating temperature and burn them. So it's really important that your stones are all immersed into the bath. That's all that we ask. And you can use almost any heating element that can immerse all stones into the bath with some caveats. I'm going to go through those in a minute. And we want to make sure that the bath can be as low as 120 to 135 degrees. Did you know that there are some heating elements that do not go below 150 or 200 degrees? You can't use those in hot stone massage. They might be cheap or convenient or what have you. But if you can't get the stones in a proper operating temperature, then you should not use them. Your temperature measuring devices are a critical part of your hot stone bath, okay? So when you're practicing hot stone massage, what we recommend is that you have at least 2 different measuring devices to be able to check the bath temperature, the water that's immersing all of your hot stones. And this can be a built-in temperature gauge on the heating element itself, or you can use something as simple as meat thermometers. If you're going to use a digital thermometer, make sure it's something that you can view in the dark light of a treatment room. And if you're going to use meat thermometers, make sure it's one of the large dials instead of the tiny 1-inch dials, that you can't see the difference between 130 and 140 degrees, because 140 degrees is commonly thought to be a little bit too hot. Now, if your temperature measuring devices do not match, you know that you might have a problem with your bath. Maybe one of the devices is broken, but it's very important to have this backup measuring device by using 2. And they're both to be used equally. Just make sure that your temperature does not exceed the maximum operating range to prevent burns. Now, the operating range, like I said, how we teach here at CE Institute, is somewhere between 120 to 135 degrees Fahrenheit. Again, you need to go to a proper board-approved CE class to be able to learn hot stone massage and how to appropriately apply the stones, heat the stones, and so forth. This is only a safety protocol update, and we're stating that we do not feel it is appropriate to go beyond this operating temperature, and that if you want to work in this 120 to 135 degree Fahrenheit operating temperature, you need to seek appropriate training before doing so. Now, your temperature management. If you're already practicing and you're trying to just get some safety protocol updates, we want to make sure that you're frequently checking the temperature of your bath. This is not emphasized in enough classes, in my opinion. Every time you go back to the bath and put cool stones back in the bath and take hot stones out, that's usually cooling down the overall temperature in your bath. So what do practitioners do? They crank up the temperature, because you don't want a bath that's maybe 110 degrees. That doesn't feel very good to the client most of the time. So it's very important to constantly check that temperature and manage that temperature when you go back and forth to your bath. A couple of ways to manage your temperature. If the bath is rising too quickly, you can take the lid off from your hot stone bath, and that being exposed to the room temperature can cool it down and stop it from going into a bad operating temperature. And if your temperature is getting too cool too quickly, maybe you've added in a pile of stones and didn't progressively add them in that were all cold, you can put the lid on, and that will also help in addition to adjusting your temperature dial. If you do overheat your stones, which is another matter altogether, it's recommended to unplug your bath and no longer use it. Let me tell you why. What happens when, and at the school at CE Institute, we've literally had students who are overwhelmed with learning the massage techniques and making sure that they're getting a really good hot stone massage on their client, that they're not really paying attention to the temperature, which is the #1 priority. So it's unfortunate to see this happen, but it's good that it's done in a school environment where you're learning, because that 200 degree bath, if you take ice water and try and pour ice water in there, all you're going to do is cool the outer surface of the stone. That inner core of the stone could still be 200 or 180 degrees Fahrenheit, and you might be able to handle the stone for a few seconds because the outer surface is cooler due to ice water. But once that inner core starts penetrating the outer surface of the stone, you're likely going to burn your hand. And if you drop it on the client and leave it there because you can't touch it, you're probably going to burn your client too. So it's recommended that if you overheat your stones, to unplug the bath and discontinue use. And this doesn't just come from me. There's some insurance companies there that have these types of requirements, such as if you overheat your bath, our requirement is you unplug the bath. If you are using or if you're practicing hot stone massage, you must use 2 temperature measuring devices. If you are practicing and you want liability insurance for your hot stone massage practice, which we insist that you have. I know that Massage Magazine has an liability insurance, and I believe they do cover hot stone. You would need to check that with them, but you want to make sure that you read any of the practice guidelines or protocols or requirements in order to be covered to practice hot stone massage. Because if you're not practicing the requirements and you do injure someone, you're probably not going to be covered, even if your premium is paid in full. Now, I want to talk about placement stone use. Placement stone use, and again, some insurance companies have requirements for placement stones too. You have placement stones that simply sit on the body, and then you have working stones that are usually in your hands. We also call them palm stones that you massage the client with. So there's 2 types of stones that are used traditionally in hot stone massage. You have your placement stones that don't move, and your working or palm stones that do move. Your placement stones, they might also be called static stones. All placement stones now must have 2 barriers between the stone itself and the client's tissue. Okay, you can no longer place a placement stone direct on a client's skin. That's how skin is being burned. So while you can massage someone pretty safely with a 135-degree stone, you would never be able to leave it on their skin at 135 degrees. It's probably going to burn. Okay, so now we require a minimum of 2 barriers between the client's skin and the placement stone. And that can be like a towel and a thicker sheet, or a towel and a blanket. And then what I usually do is I cover up the placement stone with the towel to try and retain the heat so it lasts longer, which is really nice for the client to receive that thermal therapy. Now, with your placement stones, one of the things that we want to do after it's placed is check the client's skin. Okay, let's make sure that that skin isn't burning, even if we've checked the operating temperature. Some clients could be on medications that could thin their skin and so forth and make them more prone to burns. You might have an oncology client who's been radiated and is now on opioids, because opioids are commonly prescribed in cancer patients, who is a little bit not thinking clearly and thinking massage, what do you need to know their medical stuff for? And they just want to get on the table and relax and receive and enjoy. And so sometimes you can't always rely on your medical intakes. You actually have to do double duty and check up on what you're practicing to make sure that you've done no harm. So after you place your placement stone, within a minute, and definitely not longer than 2 minutes, you're going to pick up your 2 barriers and you're going to inspect the skin visually with your own eyes. You want to make sure that there's no blistering, that the skin isn't turning some extreme discoloration. And if you have like an excessive pimpling, that might be exposure to the air after excessive heat. There's a number of things that you might want to check and look for. And if it seems to be excessive, remove it. Okay, that's fine if they enjoy it, but you don't want to burn them. It's not about so much what they enjoy. It's more about protecting them so they're not injured, okay? And you should be able to find that happy balance with allowing them to enjoy the heat without having this extreme temperature that could potentially burn as well. So if you check the skin, it's looking wrong, remove the stone. That's just something that you must do. Retired placement stones. Now, we used to place stones in between the toes. We called these cozy stones. And those are those coin-sized stones, like quarters, nickels, dimes. They're very thin, almost the thickness of a coin. And they're usually placed 4 to each foot between each toe. And most people love these, but we're not practicing with these anymore. There's really no good way to be able to put an effective 2 barriers between the toes and the stones. And because we do have this new 2 barrier requirement that we asked for here at the school, and some insurance companies might also be asking for as well, we're just saying this is a retired practice. We know it might have felt good, but we're no longer doing it because we don't want anybody to be burned. Keep in mind the tissue between the toes is extremely thin. So it's a very high risk area for burn. Okay, another area where we're no longer placing placement stones is, or static stones, is on the abdomen. We're no longer placing stones on the abdomen because, especially with female clients, we would have to do a breast towel over the breast to be able to pull the sheets back and look at the abdomen and make sure that there are no signs of extreme discoloration or blistering or so forth where the client could be potentially burned. Keep in mind the abdomen is another area where there is extremely sensitive skin, and this could be a higher risk or more potential for burn. Another placement stone or static stone that has been discontinued use is when we're in supine position. We no longer have the client sit up and place stones along their spine on the paraspinals and have the clients lie back down onto the stones. We just don't do that anymore. It was never a good idea to have a client lie on a temperature modality. They shouldn't be lying on ice, and they shouldn't be lying on heated stones either. That's just contraindicated to lie on something that is of a temperature concern. So when we're practicing our hot stone massage, we are no longer allowing our clients to actually lie on the stones. This is another way where a client can be burned, and it is why it is discontinued. Also, facial placement stones. The way I was trained in European stone massage is we did one cozy stone on the third eye, and after you massage the face, we put 2 more stones over the eyelids. So the skin on the skin on your eyelids is extremely thin. Okay, so even if the temperature feels acceptable in your hands to say, okay, now I'm going to place these stones over the eyes, and you're saying it to yourself, of course, not your client. What happens with a therapist's hands when they've practiced a lot of hot stone massage, and I know it's happened to me, your hands become desensitized to temperature, especially when you start working with the stones in any new appointment. So you might feel like these stones feel acceptable, but to the client, it might not feel so. So we're just saying anything that cannot have 2 barriers between the stone and the skin, and most of the time you're not going to put a little cozy stone through 2 barriers, you're not going to feel it. We just have discontinued that. It's no longer practiced. Now, believe it or not, we have heard a story from an insurance company that told us about a practitioner that was using those Playtex gloves, those yellow ones that you wash dishes with. They're insulated. And a practitioner thought, well, if I can stick my hands in these Playtex gloves and wash dishes in really hot water, that would be a good use for hot stone massage when I'm sticking my hands in water with really hot stones. And unfortunately, they were using the bath at too high of a temperature, and their hands couldn't feel it. And that was an inappropriate use of an application of hot stone massage. You should never, ever, ever use gloves for hot stone massage application. Never. If you have to use gloves, then you're either not a good candidate to practice hot stone massage, or your hot stone bath is too hot for application. It's just never use gloves. There's no reason to do this. And if you're using gloves, then you properly cannot feel the temperature, which could lead the client to becoming burned. Now, we have some therapists that have told us they don't like the heat. Well, and they have skin sensitivities to heat. This is a practitioner issue. They are not a good candidate to practice hot stone massage. there are at least 30, 40, 50 different modalities that are actively being taught in the United States today for massage professionals. Practitioners who have heat sensitivities, they do not need to pursue hot stone massage, okay? That's just not a good fit for them. So if you are uncomfortable handling the heat of a stone, then your client is likely going to feel that uncomfortableness as well. You should be very comfortable in handling a stone in a proper operating range to execute a professional hot stone massage. And if you're not, we do not recommend practicing at all. Now, several years ago, I do a lot of research for the school, and we teach evidence-based modalities here. And one of the research articles, it was actually a case study that I found, was a client had their transverse and I believe some spinous processes fractured in a massage therapy session. And I don't know if it was from stones. I didn't review the research in full, but this has happened in a professional massage session. So we need to be very careful. Your stone is an extremely hard object, okay? Make sure that you never push a stone into a protruding bone, especially something as thin as the spinous process and so forth. You could fracture it, okay? So make sure you attend a proper massage therapy, hot stone massage therapy course before you start applying hot stones, because these courses should teach you different large muscular areas that you can apply in the body that feel wonderful and really aren't a huge risk to you or your client. Now, hot stone client communication. It's really important that you check in with the client and make sure they're comfortable with the temperature of your hot stone application. If they're not comfortable, if they say it's too hot, you should remove all stones immediately. Okay, that means all the placement stones need to come off the body and you're no longer working with the stones. And ask them, where does it feel uncomfortable? Where is it too much? And they might say all over, or they might say it hurts in my back or upper back or lower back or whatever it is. And you need to check that skin. Do a skin check. Make sure you don't see anything harmful. Now, if they might say, I just don't like it, it's too hot for me. And that's fine. You're just going to discontinue your hot stone massage, and then you can do whatever other type of massage you're trained to do and they want. Or they might say, you know, I really want to do this. It just feels a little bit too hot. And what you can do is you can turn down your hot bath a little bit, maybe at least 10 degrees. And once you get your hot bath cooled down, you can start your massage again and ask them if that's a more appropriate temperature. To change the temperature, one of the things you want to do is just lower the temperature on your temperature control device for your hot bath unit. And also, if it's covered, remove the lid, because when that stone bath is exposed to air temperature, which is usually around 70 degrees, it can cool it quite quickly. You would never put ice in the bath to try and cool it, because again, that can cool the outer surface of the stone, but the inner surface could penetrate to the outer surface and burn the client. That's why when we overheat the baths, we never ever use ice to cool them down. We're just going to unplug the device and continue your massage, any type of massage except with the stones where they could potentially burn the client. Now, infection protection. Hot stone massage is the application of something that's warm and moist and dark and a perfect breeding ground for bacteria. So it's really important between every client use that you unplug the bath and bring the whole bath to a sink, wash every single stone individually and rinse it. Remove any liners, like any towels you have inside the liner, to be washed, and put a new, fresh, clean towel. And then the liner itself, the hot bath liner, should be washed. And this hot stone sanitation education should be provided again in an appropriate CE class. So hot stone safety training. This is just a minor list of some safety protocol updates. It's really important that you gain proper education and how to apply hot stone massage if you wish to practice it. And in those hot stone massage classes, most of them will have things such as contraindications, local contraindications, total body contraindications for hot stone massage. You would need to learn this and more for a proper professional hot stone massage appointment. Also, if you choose to train with us here at the school for your hot stone massage, I do want to mention, not only do we do hot stone massage training, but we also created something called Lava Lomi. So there's two types of hot stone massage applications we do at CE Institute. There is with Lomi Lomi massage, we do ancient temple style stroking with the stones. We call them toes to nose strokes, but they really go from like the Achilles up to the trapezius and back. They feel wonderful. They're blissful. And right now we have something like a 45-step full body massage protocol that's done with a Swedish massage, where we do the back, one leg, and then the other leg, and then flip over. And we use placement stones and working stones for those. And it's all wonderful. So you can find our training and more at ceinstitute.com. And we do hope to see you in class. Thanks, everybody.